Life asked Death, "Why do people love me but hate you?" Death responded, "Because you are a beautiful lie and I'm a painful truth." The developing world represents over 80% of the world's population. People living in these countries typically die younger, have less education and money. Asia is home to 60% of the world's population. Many of these people live in developing economies. That means less physical and human resources for essential public services, including health. The burden of a disease like cancer in countries like Myanmar, Sri Lanka and Bangladesh is immense. By the time it's diagnosed, 80% of cancers in the developing world are incurable. The result, a vast sea of human suffering. But there is a solution, a medical discipline whose focus is to treat pain and alleviate suffering in all its forms. That medical practice is palliative care. Services beginning to spread across the developing world have the potential to improve the lives of tens of millions of people every year. This is the story of a revolution in healthcare. In Myanmar, the healthcare system is often pushed to its limit. High patient demand and overcrowded wards mean even basic medical needs can be difficult to implement. In such conditions, trying to introduce palliative care for those with non-communicable diseases such as cancer is a challenge, but one that must be met. Worldwide, non-communicable diseases kill 38 million people a year. The need to treat the pain and the associated problems caused by these diseases is just as important as treating the illness.
I mean, she did complain that her pain was 10 on 10, and then after the injection that we gave her, the tramadol, which she's been getting just twice a day, the pain came down to 5. She does seem more comfortable now with the pain at least. But I think the patient is also not fully aware of what's happening. The caregiver is very, very surprised. We know that almost 2/3 to 3/4 of all the patients who are cancer patients would have pain at some time during their lives. We need to control that. So you've got to analyze and you've got to really look into the pain control and see whether what you're giving is adequate or not.
Dr. Akhilesh is part of a team visiting the Yangon General Hospital on behalf of the Lien Collaborative for Palliative Care project. This supports teams of experts from all over the Asia-Pacific region to share their knowledge with doctors, nurses and social workers across countries like Myanmar. The program partners with suitable institutions within the government healthcare system, such as training hospitals.
Now, for whatever reason you think this patient can go on to morphine.
Within these teaching hospitals, spread over 3 years, the participants will attend 6 weeks of teaching, which will include lectures, case-based tutorials, role play, and clinical bedside mentoring. In between these teaching visits, the participants are expected to practice what they've learned in their daily work and eventually to start palliative care services in their hospitals throughout the country. These services will later become training centres to pass on skills and expertise to other healthcare workers. This will be hugely beneficial to people in rural areas, like Mr. Sain La Aung, who currently has no access to pain relief medication where he lives. He and his wife travel across the country every 3 weeks to the Yangon Hospital so he can undergo chemotherapy treatment for the tumour at the base of his mouth.
He's got pain from the chin, yes, but he gets sharp shooting, especially between midnight and 2 a.m. that goes up.
Associate Professor Cynthia Goh and Professor Mira Agar of the Lien Collaborative are expert faculty in the programme, who are passing on the skills they have learned to the local doctors and nurses.
She doesn't turn up for work, so she has to go today. Yeah. If she misses, she may lose her job.
As Mr. Sain La-ong is not at work, his wife is now the sole breadwinner for the family. They also have a child. Due to the time she's taken off accompanying her husband, she risks losing her job. So the family faces financial difficulties due to the illness.
I'm sorry you have this pain today. Yes, and it's disturbed you last night, is that right?
Yes, he cannot.
And the doctors here...
The pain relief medication Mr. Sain La-ong is taking is called tramadol, a medicine like morphine but nowhere near as strong.
How bad is it now?
Still in 18 days. Just the first dose of tramadol 15 minutes ago. All over. He went to shout out.
Because
there are many people, so he controlled himself.
Oh, okay. Have you taught him the pain score?
Yes, 8 out of 10.
So right now it's 8 out of 10, so it's very bad. Very bad.
Five or six.
Well, 5 or 6 is the background, so there's quite a lot of way to go that we can titrate, yes.
Morphine is recognised as the gold standard in pain relief and would most likely provide Mr. Sain La-ong the pain relief he requires, but it's in very limited supply here. Worldwide, there are approximately 14 million new cases of cancer diagnosed each year, whilst over 8 million people die annually from the disease. Initially, for all those who suffer a life-threatening disease, it is the need for pain relief in all its forms that is all important. Cho Win is only 34 years old and has been treated for cervical cancer. She is a single mother with a young son. The pain she suffers now is from the spine compression due to the cancer having spread to her bones. Apart from her physical pain, she fears she will become paralyzed. Just the mention of cancer feels like a death sentence.
She's afraid to pain and she wants to die peacefully without pain. Can you explain to her we don't yet know exactly because we don't have the results of the bone scan?
The palliative care approach is to treat the pain and the problems associated with life-threatening illness. It does this through the prevention and relief of suffering by means of early identification and correct assessment and treatment for the patients and their families.
And we look after them from not just the physical care, but also the psychosocial and spiritual aspects of care as well. And the aim is to improve quality of life for these people. It includes people who are very early in their disease at diagnosis, and also people who are towards the end of their lives as well.
For effective treatment of moderate to severe pain, a sufferer needs morphine, and there is a small amount of morphine kept in this hospital.
So inside Previous last 10 years ago. Yes.
You used to keep the morphine in
yes.
there.
And
Cynthia Go, team leader of the Lien Collaborative Training Group, wants to see the cancer ward's morphine supply for herself.
So where do you keep the morphine now?
The sister says there is a box containing a small supply of morphine to be used by the cancer ward.
themselves inside that box.
Right. Yes. May we take a picture of where you keep your morphine now?
The box contains 3 small packets, each one containing 10 ampoules of a 15-milligram dose of morphine.
How long will this stock last?
It's a minute supply for the number of patients. A patient in severe pain may use up to one of these packets in a single day.
I think considering how many patients there are in the ward, how many patients do you have in the ward for medical oncology and radiation oncology?
Total patient.
Two types.
Total patient is around about 200 to 250 patients per day.
Per day, yes. And you use 30 ampoules of morphine in 1 month?
1 month, yes.
1 month, yes. And you only have injection morphine?
Yes, we have
And there's
no oral morphine, tablet or syrup, no.
That's right. Very precious box, yes.
Morphine here can only be given by injection and cannot be taken home by patients. Until morphine is more widely available in Myanmar, patients will not get the most effective pain relief possible in hospitals. They may not get any pain relief once they leave. As an opiate, like this oral version found in Sri Lanka, the strong painkiller morphine is often viewed in the same unfavourable light as illicit narcotics by many governments. This can make patient access to this gold standard pain relief almost impossible. Even where there is access to morphine, it may only be limited. Getting enough of it to go around is problematic. The Lien Collaborative works with governments to help integrate palliative care into the existing healthcare system. They work with the policymakers, pharmaceutical manufacturers, and drug regulators to try to make essential pain medications available, affordable, and accessible to all those who suffer the pain of a life-threatening disease.
So cancers will be, much more common. If you take cancer patients, alleviation of pain is very important to improve the quality of life. So for which, of course, we have taken many policy decisions, even availability of, pain relief drugs. We have taken a policy decision and now it is available in all the government's institutions, as well as patient can buy it from certain pharmacies.
Each year, around 40 million people worldwide will require palliative care, of which 20 million will need end-of-life care. The physical pain from a life-threatening illness is not always the only reason for a person's suffering. Not understanding what is happening, fear of the unknown, can cause great mental anguish.
We could ask her, when did she start to get better?
Associate Professor Gary Agarwal, a trainer with the Lien Collaborative, is accompanying a team of doctors and nurses participating in the programme. This patient is 38 years old, married, and has a young son. She has lung cancer and a leg infection.
Does she remember that another group like us came to visit yesterday? Did she find any of that beneficial?
Some strength when she was discussing with the school.
Why? Why did she?
Why?
She learnt more about her situation from the team of doctor and nurse participants who came to speak to her the previous day. Even though she now suspects her illness is very serious, she has taken some strength from simply gaining knowledge, and now she wants to know more.
So you can see that talking to the patient, asking them what they want, focusing on their concerns. The whole way through when we've asked her, her biggest focus is about getting information. She wants to talk. The therapeutic intervention yesterday wasn't giving her morphine. It's the fact that the team came and sat and spoke to her for 20 minutes. And look at her today compared to yesterday. See you later. How do I say bye-bye? Whatever? Yengena.
The need for sensitive, honest communication between healthcare workers and patients is a vital aspect of palliative care.
Thank you very much. Thank you. Yes, she's definitely happy. It's actually very therapeutic for her, I think, this attention. So.
Not communicating with the patient simply worsens the fears they may already have of their illness, for what the future holds for their family, of the possible financial burden. On top of all this mental anguish is the physical pain the patient may be suffering. This is the concept of total pain. Good communication between patients and their healthcare teams can help to alleviate this suffering. Not disclosing the nature of an illness or the prognosis, being the likely course the illness may take, simply leaves the patient in fear of what has not been revealed. Simple it sounds, the revealing of information to patients is a skill that has to be learned. The expert trainers share their knowledge and experience of communicating with patients and their families with the doctor and nurse participants.
Good pain management and good communication. Explaining her to the realistic condition, what is happening to her and what you are doing. If you will keep on giving radiotherapy, she will keep on thinking that I will be all right. So it's the right time that we should sit down with the relatives and the patient to explain her the real situation, what treatment we are giving, and only morphine and crocin is required for this patient.
Lectures, role play, group discussion and clinical bedside mentoring are all important for participants to experience what can be difficult conversations to have. Honestly communicating the facts does make a difference for a patient who is suffering. A patient knowing the reality of their situation allows them an understanding of what their treatment is doing for them. It means they can plan for the future, have time to find closure in relationships, or perhaps organise their families and finances. 60-year-old Sophia Khatoon had originally been diagnosed with cancer in her right maxillary sinus just below her eye. However, she is now suffering from pain in her abdomen. Dr. Doug Bridge, a trainer with the Lien Collaborative, is with the team of doctors and nurses participating in the programme. Dr. Ranganshu Das is a cancer specialist and participant.
She's also complaining of abdominal pain.
Cancer in the face does not cause abdominal pain. Even when she took a deep breath, it seems to cause pain. And she's now explaining to the nurse what the problem is.
We need to keep some.
She needs some analgesia very promptly.
You can try with morphine.
I'm sure a single dose will be perfectly safe.
The Lien Collaborative has worked with many organisations in Bangladesh in getting morphine made available within the country.
Here comes the tablet.
There is now a reasonable supply of morphine here, available in tablet form. But for some patients, a tablet can be difficult to swallow, and a morphine syrup would be easier to administer. However, there's currently none on hand.
I had not realised just how difficult it can be to swallow one morphine tablet.
What's that?
After several minutes of exhausting struggle, Mrs. Khatoon swallows the tablet. The morphine soon starts to work.
At least her face now looks peaceful. She looks pain-free. She's going to have a sleep, resting on her sister's shoulder.
Mrs. Khatoon is left to rest, at last pain-free. Though she had been scheduled for an intense course of radiotherapy treatment to cure the cancer in her sinus, the doctors now find she has a different problem. A new direction for her treatment will have to be considered. With the spread of their mother's pain, Mrs. Khatoon's children want to know what is going on.
They don't have any clear idea about the prognosis. They know it's a cancer, but the prognosis, the survival is not being explained to them.
We need to talk with the other doctors first.
Yeah.
After speaking with Mrs. Khatoon's doctor, the cause of her abdominal pain is confirmed. Mrs. Khatoon has a much more serious cancer in her abdomen, which is not curable. The family decides that further radiotherapy to her sinus will not help meet their mother's needs. She wants to return home and spend the rest of her time with her family with as little pain as possible, and eventually to die in peace.
And the medicine I can see is written there, they will follow accordingly.
A care plan has been devised so that she may be cared for at home, a decision made by Mrs. Khatoon and her family together.
So the family will take care of the patient at home. She will be at her home and the whole family will be taking care. So that is a good idea. And they, at this point, really understand what is the prognosis, and there is nothing good to be done with all the curative treatment. That's why they agreed to go home.
We're no longer aiming at survival, we're aiming at comfort in dying. I hope it goes well for them.
Mrs. Khatoon's goal of care would not be served best by pursuing an intensive and painful treatment in hospital. Empowered with the knowledge of her situation, Mrs. Khatoon and her family are able to decide what is best for her. Sophia Khatoon goes home with her sisters and children so that she can spend the time she has left with her loved ones. Palliative care is a proven and effective way of improving the quality of lives for patients and their families facing life-threatening illness. The skills needed to provide palliative care can be acquired, and the drugs necessary for pain relief are easily affordable in developing countries. Programs like the Lien Collaborative demonstrate how far a little can go. The opportunity now is for countries to build palliative care into their national health systems. This can be done and must be done to alleviate the unnecessary suffering of so many millions. All of us are likely to need these services one day. For millions around the world, death is indeed a painful truth, But there is an alternative which delivers quality of life until our dying breath. This is not a beautiful lie. It is already here for the asking.